Everyone, welcome back to Haley on the Go. I'm Haley. We have new episodes every Thursday, so make sure to follow and subscribe wherever you get your podcast to never miss an episode. This week, we're diving deep into a conversation that has likely impacted every single one of your families and millions of Americans across the country. Today, we're welcoming Ai-Jen Poo, the president of the National Domestic Workers Alliance, an advocacy org working to promote the rights of domestic workers in the United States, and who is at the center of the fight to fix America's very broken care system. If you've ever relied on a home aid worker or a home nurse, or have been responsible for a loved one who will eventually need long-term care or needs long-term care, this conversation is about you. Ai-Jen is also the director of Caring Across Generations, an organization working to transform what long-term care in the United States looks like, and she is the recipient of a MacArthur Genius Award. Ai-Jen, thank you so much for the work that you're doing and for taking the time to come chat with us.
Thank you, Haley. I'm such a big fan of yours, so I'm excited to talk to you.
I'm so excited to be chatting because this is a topic that is really near and dear to my heart.
They work every day and they provide childcare, so they take care of and nurture the human potential of our babies and our children. They are the direct care workers who care for our disabled and aging loved ones. Well, it actually started almost 30 years ago when I was working in New York City. Actually, I was a student at Columbia, and I would just notice all of the immigrant nannies who were taking care of kids in Manhattan. And once you start to see this invisible workforce, you can't unsee. And I used to go to the parks and playgrounds in Manhattan and just sit on the park benches and talk to the nannies, listen to their stories, and just I was in awe of the work that they did and just realized that there was this invisible life force of domestic workers that make everything else possible in New York and also in our country. And it's so undervalued. So many of the nannies that I talked to talked about not having a contract, not having consistent hours, not having any access to something as simple as a paid sick day or paid time off to take care of their own families when they need it. And it just made me realize that the work that makes everything else possible in our economy and in our society is some of the least valued and least protected work. And it's part of this much larger pattern in our society where we just don't really value care, even though it's the most essential thing in all of our lives.
I really love how you called it the invisible workforce. I think that that is a perfect encapsulation of the way that we view care workers and the fundamental role that they play in our society. We're going to talk more about what that role looks like and why it's structured the way that it is. But I want to make sure that we're providing the context that everyone needs to follow us along. So can you quickly explain what a care worker is, who that encompasses, and what kind of we're talking about when we talk about the care system?
Yes. So care workers are the professionals who go to work every day and they provide childcare. So they take care of and nurture the human potential of our babies and our children. They are the direct care workers who care for our disabled and aging loved ones, making sure that they can live full, dignified lives in the community, but also in settings like nursing homes or assisted living facilities. And it's a workforce that's about 9 million strong, overwhelmingly women, mostly women of color. About a third of the workforce is immigrant women. And so it is a backbone of our larger care economy, which is this part of our lives, our society, of our economy that is about the care that we and our families need from the time we're born to the time we leave this earth. We all need different types of care at different stages of life, and that is child care. It's also policies like paid leave that allow us to step away from our jobs. We need to take care of ourselves or a loved one without having to worry about losing our pay or our job. And then also programs like Medicaid that support home care, in-home services, also nursing home care. So it's a whole suite of policies It's a workforce, and it's also 63 million family caregivers and working parents spend a lot of hours of our days and our lives taking care of our loved ones.
The care economy is not only so large and vast. You talk about the 63 million Americans, but it's also so foundational to the rest of our economy and people's ability to go have careers, go have jobs, make money, be there for their family, like any of the things. I want to paint a picture of the crisis we have right now so we can talk more about what we're facing today. So, across the country, care workers are taking on second and third jobs, making below poverty wages. 1 in 6 home care workers in 2025 live in poverty. And child care workers are among the lowest paid jobs in the country, despite how fundamental they are. At the same exact time as this, more than 700,000 families are stuck on waiting lists for home care and nursing homes. So we are underpaying and undervaluing our work care employees while there's also a desperate need and shortage for those workers. How did we get here? And why, in your opinion, is care work so undervalued when it is so fundamental to our society functioning?
I'm so glad you laid all of that out. And the other side of that is that we're also paying so much money for care. It's like top of the affordability crisis for us. Like the average cost of childcare is more than 10,000 a year. The average cost of a room in a nursing home is more than 100,000 a year. I mean, it's really just so unaffordable on the one end, and then we're underpaying workers on the other end, and so much that they're living in poverty. And we got here because we as a country are so far behind in investing in care as a fundamental question of infrastructure and of the common good. Other developed nations have programs that make long-term care universally affordable and accessible. They have affordable childcare programs. They have subsidies for childcare. They pay care workers minimum wage at least that allows them to sustain in the workforce. We are the one of the only countries in the whole world that has no national paid family leave program, which means that 1 in 4 moms has to go back to work within 2 weeks of giving birth in our country. It's wild. It doesn't make any sense. So we have just never built the kind of infrastructure that modern societies need for care in order to be sustainable. And so it means that we have overpaying families. We're paying too much on the cost side, and we're underpaying workers, and we're over relying on family caregivers and working parents just stretching themselves into knots every day, and then workers living in poverty. There's a social scientist named Jessica Calarco who says other countries have a safety net. The US has women. And that to me says it all, in that we're just relying on the kind of ability of individual women and families to stretch ourselves into pretzels in order to make it all work. And it's not sustainable.
Other countries have a safety net and the US have women is probably going to become so overheard by anyone who talks to me now. That is really such a powerful statement. And it really transitions nicely to my next question for you, which is the majority of this audience and my audience are young women. And you previously mentioned in this interview that, a disproportionate amount of the care economy is women, women of color, and immigrant women. How much of the fact that that is the makeup of the care economy contributes to the fact that we've yet to see infrastructure and policies be put in place that values them properly, that allows economic success and for the care economy to be sustainable, not being in place?
I think that the fact that we culturally associate this work with women, the fact that it's women and women of color who've always done this work as professionals, our first domestic workers in the US, many of them were enslaved Black women. I mean, all of this is a part of how we come to systematically devalue this work. And we also have systematically excluded domestic work and care work from equal protections that other workers take for granted. And I do believe that it has a lot to do with who this work is associated with. And it also, to me, is a very hopeful thing because at the end of the day, we are a country that needs more care than ever before. Everyone needs care. Everyone is going to be in a position of having to provide care. And so we are at a kind of tipping point moment where I believe that we are the generation that's going to fundamentally change the way we support and value caregiving in our country. And it's going to be women leading the way, women of color, care workers, family caregivers, parents, but it's going to be young people who really demand that change. And I'm seeing it now where young fathers, millennial fathers, right? 10,000 babies are born every day to millennials. And I'm seeing fathers stepping up in a way where like the expectation of their role in fatherhood is totally different from previous generations. That is baby boomers are now taking care of their parents and they're also aging. And 38% of family caregivers for older adults and people with disabilities are men. So we're at a cultural tipping point moment where we, as younger generations, can totally transform the way that we culturally treat care and value it. And men have a role to play in really flipping the script on that as well. And I really believe that it's young people who are going to help us do it. And more young people are in caregiving roles than ever before. And I just want you to know if you're a youth caregiver out there listening to Haley, like you are not alone. There's 6 million young people who are in caregiving roles, and the caregiving movement is determined to make sure that you have a better set of choices and more support than previous generations.
I find what you said about the gender roles here really fascinating. Something that I focus on a lot is sort of the way that young men are being radicalized online or indoctrinated into certain sort of mentality. And millennial men sort of skip that. And we're seeing that they have really shown up in the home, as you've mentioned. They're helping to change a lot of the ways that we look at things as society. But then the next generation of men right below them is not aligned necessarily or trending in that same way. So I'm not sure if you've thought about this, but I am curious what you think in terms of maintaining the strides we've made in changes to the way that we view home care workers, domestic workers in general that are happening with the current voting population or the loudest sort of activists with the next generation of voices that are being raised right now who are moving a bit more conservative.
Yeah, I think what's great about care as an issue is that it really does reach across partisan lines.
100%.
Everybody has loved ones who are disabled, who are aging, who need care, who provide care. And so it's a very easy entry point to have a conversation with anyone about anything. In fact, a lot of our meetings, we start with asking people to turn to the person sitting next to them and just share a story about someone in their lives who's cared for them or someone they care for and what that relationship means to them. And the room just always like lights up with a glow of humanity and understanding and connection in a way that's so powerful. And I think for young men, I mean, so many people feel alienated, isolated, and unseen right now. And I think that young men are no different from that, and they're being targeted in our online environment and our media environment, and they're being targeted in very specific ways. And I think we also have to be targeted in how we're reaching out to people and having the conversation and finding those entry points, like having a conversation about care and conversations that are relatable and that help people feel strong, seen, and connected. All the things that I think most people, young and across every age, really want.
I think that care work is such a idea that can relate to everybody because I always say, like, the things that will advance us are where we can put people over policy, policy over politics. And care work is really people first. And that humanity element of sharing those stories that you mentioned shines a light on that. You mentioned also that so much of care work is covered by Medicaid. And so I know you've been sounding the alarm bell around Medicaid, and I don't think people are noticing how consequential the decisions being made right now are when it comes to our ability to access care. Medicaid is how 80 million people in this country get health care, and it also funds a lot of long-term care. Something that I didn't know is that 70% of home care workers are paid through Medicaid. So, can you talk a bit about how Medicaid works when it comes to the care system and how cuts or changes to the policy that exists or has existed can impact everyone's ability to have the care that they need and rely on?
Yeah, I'm so glad that you raised this because healthcare is so top of mind for so many of us. And a lot of people, when they think of Medicaid, they think of healthcare for low-income people. And it's true, like so many low-income, working-class people, people who worked in retail, but also in care, other low-wage jobs, the only way that they were able to get access to healthcare is when Medicaid was expanded under the Affordable Care Act and more people were eligible for Medicaid. The thing that people don't realize is that long-term care or the care that you need when you start to lose your mobility or you develop a disability or you need more assistance with activities of daily living like bathing, dressing, eating, moving around, which is what a lot of older adults who are healthy and otherwise fully capable of living a full life, they just need more assistance. Like that kind of care, we don't have a program that supports that kind of care in this country. Other countries like Canada, the UK, Germany, they do. We don't. A lot of people assume that Medicare will cover that kind of assistance. And it just doesn't. And so the only way, if you need if you had your grandmother had a stroke and she's back at home and she's recovering, but she needs more care now, the only way that you can afford that care is to pay out of pocket, which costs $100,000 a year, maybe more, or you can completely spend down your assets, impoverish yourself basically, so that you can be eligible for Medicaid for her to get those services. And that is a huge driver of inequality, but at least it's a safety net that's there so that grandma can have assistance. And so 70% of all in-home care, which is where most of our grandparents, our parents, where most of us want to live, even as we age, in-home care is supported by Medicaid. The vast majority of people with disabilities who get assistance and rely on assistance to go to school, to go to work, to live, to just have a life in the community, they get their assistance through Medicaid. So it's a huge, huge support and a huge part of our care infrastructure in our country. And the big ugly bill that passed earlier this year cut Medicaid by almost $1 trillion, and those cuts are going to be coming into effect at the end of next year. And states are going to start to prepare this year. And so my concern is right away, starting early next year, you're going to start to see different costs go up, state budgets get tighter, cuts to other essential services to try to prepare for the big hole in state budgets that's going to be left by the cuts to Medicaid. And then once the cuts to Medicaid start rolling out in the end of next year and early the following year of 2027, people are really going to start feeling the pain. And I'm concerned that a lot of older people, people with disabilities, family caregivers who rely on Medicaid for their care at home are going to be on the front lines of some of that pain. And so that's why we have to come together, Haley. I mean, I'm so glad you're raising awareness about this because people aren't dialed in. There's so much going on. It's so hard to know what to focus on. And care is so important, and I just want as many people to know that care is at stake right now. In every policy conversation and every election, care is on the table, and we got to tune in, dial in.
So, you just chatted a lot about how the care infrastructure is potentially going to fall apart for a lot of families, the sort of insurmountable costs for paying out of pocket when it comes to care. These are all really negative and disheartening. What do we do to fix this? If you could wave a magic wand, what are the policies and the infrastructure changes that should exist to support care in this country? What does that look like?
Oh, it like what New Mexico just did. New Mexico just made childcare free for everyone in the state. Can you like this
Okay, but
is
I have to
doable.
say
We can do
about the
this.
childcare is it is revolutionary that New Mexico did this, but I think a lot of people forget that the US actually did have a paid childcare universally in this country exists, and they built out that infrastructure during World War II so that women could
Yes.
volunteer for World War II or be nurses or go work. And then they had 500,000 to 600,000 children receiving subsidized childcare, and it worked incredibly well. And then they just took that away after World War II because they wanted women back in the house, not because we didn't prove that the infrastructure could exist. So while it's revolutionary that New Mexico is doing this, our country's done it before.
100%. And Congress passed a universal child care bill twice, both houses of the legislature, and President Nixon vetoed it. But the country has been ready for universal child care for a long time. The state of Washington just passed a long-term care benefit that is universal, that's for everyone, whether or not you're eligible for Medicaid. You can get access to this benefit called Washington Cares. And that's the kind of thing we should be doing nationally. And it benefits us in every way possible. It helps us raise the wages for care workers, helps make care more available and accessible for families who need it, and therefore supporting all of us to be able to go to work and do what we do every day in the economy. And it's just a win-win-win. And so it's possible. The country has proven over and over again that we need it, that we want it, that these policies are popular across partisan lines, they're unifying, and they're universally beneficial. So that's why I'm hopeful, even though we're seeing cuts and bad news, we're also, I think we are trending towards a real revolution in care in our country. And I'm really counting on your listeners and all of us who care about care to really be the tidal wave that brings in that change.
It's really exciting to see some of these policies start to get implemented in states. And I'm hoping that people see how effective and impactful that they are and it spreads a little bit. So keep your eyes on New Mexico. I want to wrap this up by asking you, I've heard you say something that is really powerful and stuck with me. And part of the reason why I wanted you on this pod is to embrace the village. And so I wanted to ask you to wrap us up by sort of explaining what that means to people and any sort of call to action you have for people to support the work that you're doing.
I look at the world through the lens of care, and care was never meant to be a solo endeavor. It was always meant to be a collective community project, a intergenerational project. And when we think about, we are a country that needs more care than ever before, and that is a good thing because care connects us. It brings us together and it helps us build community, build trust, build relationship. And that is what's going to power the kind of change that we need in our country so that we can all have care and freedom and opportunity. And I believe it so wholeheartedly.
Thank you so much. Everyone, embrace your village and support that invisible workforce in your life, whoever and however that may be showing up. Thank you so much for listening. Make sure to follow and subscribe wherever you get your podcast episodes every Thursday. We'll see you next time on Haley on the Go.